My name is Dick Fleishman. I had my partial knee replacement in October 2019 at Northern Arizona Orthopaedics. It's pretty constant pain. Sometimes I would avoid doing things that would require, okay, if I have to go up a hill, or so some of the hiking was curtailed, skiing was curtailed. Anytime I needed to bend, yeah, sure I could do it, but it hurt. My father actually had the bone-on-bone knee issue, for the last 10 years of his life, and he just refused to get it done, and it was just painful to watch him walk and limp around. To me, I said, I'm not going to let that happen to me. Once I got that persistent pain, I wanted to get it fixed as soon as possible. I mean, your quality of life with that persistent pain, it's no good. And my quality of life with pain-free knee is excellent right now. Some of the things I'm able to do now pain-free: skiing extensively, biking. Hiking is much more difficult. Able to go up and down hills pain-free now, and that's so nice. It's as if I didn't even have any kind of surgery, or my knee was perfectly fine.